Hi, I'm Bhavik. Currently a GPST one in east of England, and I've been in this role for 6 weeks. Being the GPST one in this unit on my ward, there's four of us junior doctors in total, and actually I have because I've done extra years of training after F2. I did F3 and F4. I've had quite a bit more experience in terms of emergency medicine and general medicine compared to the others. We do a lot of physical health things as well on the ward, and of course the psychiatry consultants are quite away from that. They haven't been dealing with that for a long time, so a lot of that responsibility falls on me a lot of the time, and the juniors, the F1 and CT1, will even turn to me because I've obviously had a bit more experience than them. So I've enjoyed being the person that others turn to for advice on physical health matters, and making decisions about how to handle um, complex scenarios where because the resources in the psychiatry unit are very limited. It's very different working there and trying to do your usual work that you're used to in a hospital environment. Your blood tests have to be sent to the nearest hospital in taxi. They take up to a day to get results back. You can't get blood gas results. You're quite limited, and you have to work within those limited means, and it's a bit of a challenge. And then you have to take a certain amount of risk, and it's actually enjoyable in a way because I've compared that to GP as well, because when I'll be a fully qualified GP, you don't have as many resources as you do as the hospital. So it's been quite rewarding as well. So it's the team mainly, the team of the doctors, the other doctors on the ward are great. Uh, the consultants, the registrars, and my other junior doctor colleagues, well, everyone's very supportive. Um, my consultant supervisor is extremely supportive. We have weekly supervision meetings just to check how I'm getting on, how I'm settling in, and to reflect on events that have happened, what I've learned from them. Um, the initial periods were quite overwhelming because of the new systems and new sort of working environment, and the registrars originally were very good at bridging that gap for the first few weeks to help me settle in. Um, and also my junior docs colleagues, we work together well as a team. We divide the work evenly, and it works. We found a good way to work day to day. Yeah, so initially it was more my mindset. I've never found an interest in psychiatry, so I was coming into this rotation thinking, oh, I don't really um, want. I didn't particularly want to do it. It was within a program which included pediatrics, and that was the main rotation I wanted. So initially, my mindset towards this job was, I don't particularly want to be here, but then I've gradually transformed that because things have become easier at work. The day-to-day function of work has become a bit more comfortable, and I've tried to um, more focus on what I can learn from the placement. So because there is a lot of mental health in the community, and I will be dealing with this as a GP, um, and the consultant has guided me to um, think about these things and try and reflect on them and how I can implement them in my progress. So that was a bit of a hindrance at the start because my mind wasn't really in it, my heart wasn't in it either. Um, we do experience medical emergencies in the psychiatric unit. Last week we had a patient who had a very high overdose and was unresponsive completely for about 40 minutes. It was obviously I've experienced this before, so I knew what to do, but our F1 was completely um, shell shocked by this, and to deal with it with very limited resources and other team members who don't actually have much experience about this and aren't very proactive with how to deal with an emergency, it's very different. It's very challenging. It's quite frustrating in a way because you have to almost command others to do very basic things such as bring the crash trolley or bring some fluid, saline fluid, or take a blood pressure. It's very different. So having witnessed these emergencies, I've realized that I need to develop my teamwork skills and leadership skills to be able to coordinate these emergencies and optimize a patient and stabilize them for transfer to the hospital. I had a discussion with my supervisor about other things to experience because my experience currently is a bit skewed. I'm on an acute admissions unit, so we're just seeing patients and then diverting them whether they need a treatment bed or whether they need to be discharged. So I'm going to have experience on some treatment beds, get a variety of experience in other areas like child and adult mental health, child and adolescent mental health services, and also other things like electroconvulsive therapy. So just broaden my experience in psychiatry so that I have a well-rounded experience would be the goal for the next 2.5 months. This plan to explore other areas within psychiatry has come about after having a supervision meeting with my consultant.